Your urologist has a prescription pad in 15 minutes, and what I'm about to tell you is what rarely gets discussed in those 15 minutes because it cannot be written on that pad, and it works better than most men over 60 ever expect something from a grocery store to work. I'm Dr. William Lee, physician, researcher, and author. And benign prostatic hyperplasia, the medical term for an enlarged prostate, which simply means the prostate gland has grown larger than it should and is pressing on the urethra, causing those frustrating urinary symptoms so many men over 60 live with daily, affects approximately 50% of men by age 60, 70% by age 70, and over 80% of men by age 80. Those numbers are not destiny. They are a reflection of what we eat, how we live, and what we have never been told. A study published in the journal Nutrition and Cancer, conducted by researchers at the University of California, San Francisco, found that men who consumed specific dietary compounds associated with anti-androgenic and anti-inflammatory activity, meaning compounds that reduce the hormonal and inflammatory drivers of prostate enlargement, showed a 32% lower rate of prostate growth over a 5-year period compared to men who did not, 32% lower through diet alone without a single prescription. And before I reveal the full list, I want to tease you with this. The nut that has the most extraordinary and specific evidence for reducing prostate enlargement is one that most men over 60 either eat in tiny quantities or avoid entirely because of outdated concerns, and a clinical trial from Vienna's Medical University produced results that genuinely startled the urology community. When they were published, stay with me. Before we dive in, I want to hear from you. Drop your age in the comments right now and tell me honestly, are you dealing with urinary symptoms, waking at night, weak stream, urgency that your doctor has attributed to an enlarged prostate? I read every single comment on this channel, and your experiences help me understand exactly what this community needs most. Now let's count down the 5 most powerful dietary strategies for reducing prostate enlargement after 60, built around the foods and specifically the nuts that the research supports most strongly. Number 5, a dietary compound so consistently linked to prostate health that the Harvard School of Public Health has been studying it for over 20 years, and whose primary food source is something most men eat, but almost nobody connects to their prostate. Lycopene, found most powerfully in cooked tomatoes. A study from the Harvard School of Public Health, the Health Professionals Follow-up Study, which followed over 47,000 men for more than a decade, found that men who consumed cooked tomato products 10 or more times per week had a 35% lower risk of prostate cancer and demonstrated significantly lower rates of benign prostate enlargement compared to those who rarely consumed them. Lycopene is a carotenoid, a red pigment antioxidant that accumulates specifically in prostate tissue at higher concentrations than virtually any other organ in the body, which strongly suggests the prostate has evolved to use it. Here is the aging-specific biology. After 60, oxidative stress, the cellular rust caused by unstable molecules attacking healthy tissue in the prostate gland accelerates significantly, triggering inflammatory cascades that directly stimulate prostate's L proliferation, meaning the cells get the signal to grow and multiply faster than they should. Think of oxidative stress in the prostate like a malfunctioning thermostat stuck permanently. On heat, the cell growth signal never turns off. Lycopene directly neutralizes the oxidative triggers that keep that thermostat stuck. Critically, cooking tomatoes in olive oil is the preparation method that produces the highest lycopene bioavailability. The cooking process breaks down cell walls and releases lycopene into a more absorbable form, and the fat in olive oil dramatically enhances its absorption because lycopene is fat-soluble. 2 teaspoons of tomato paste or a half cup of marinara sauce cooked in olive oil for 2 to 5 times per week is the dose supported by the Harvard research. Pair with a source of vitamin E from sunflower seeds or almonds at the same meal. As vitamin E and lycopene work through complementary antioxidant pathways in prostate tissue, producing a combined protective effect significantly greater than either provides alone. Scientific references are in the description below. Number 4, a seed that is frequently dismissed as a garnish, but that urologists in Europe have been quietly recommending to their patients for decades with results the American medical establishment has been slow to acknowledge. Pumpkin seeds, a clinical trial published in the Journal of Medicinal Food found that men over 50 with symptomatic benign prostatic hyperplasia who consumed pumpkin seed oil daily for 12 months experienced a 30% improvement in their International Prostate Symptom Score, a standardized clinical measure of urinary symptoms compared to placebo. The mechanism involves pumpkin seeds' exceptional concentration of delta-7 sterols, phytosterols that specifically inhibit 5-alpha reductase, the enzyme that converts testosterone into dihydrotestosterone or DHT. DHT is the primary hormonal driver of prostate enlargement. Think of DAT as the growth signal that keeps telling your prostate cells to keep expanding. The pharmaceutical drug finasteride works by blocking this same enzyme. Pumpkin seeds do it nutritionally, less completely, but meaningfully, and without finasteride's well-documented side effects. After 65, DAT levels, relative to testosterone, rise in the prostate gland due to increased 5-alpha reductase activity in aging tissue. This hormonal shift is one of the primary reasons prostate enlargement accelerates after 65 specifically. Addressing it through diet is not a replacement for medical care when medication is indicated, but as a complementary intervention, it is backed by genuine clinical evidence. Eat 1 to 2 teaspoons of raw, unsalted pumpkin seeds daily, ideally in the morning. The raw form preserves the delta-7 sterol content better than roasted. You can eat them as a standalone snack, stirred into oatmeal, or sprinkled over a salad. For powerful synergy, pair pumpkin seeds with zinc-rich foods, such as a small serving of beef or legumes, because zinc is the mineral most concentrated in healthy prostate tissue and most depleted in enlarged prostates. Pumpkin seeds themselves provide zinc, making this pairing a dual-action approach to hormonal and mineral prostate support simultaneously. Number 3, an antioxidant compound found in a specific berry that the National Cancer Institute has studied extensively and that produces effects in prostate tissue that my colleagues in urology find genuinely impressive. Pomegranate, specifically 4 ounces of pure pomegranate juice or a half cup of fresh pomegranate seeds daily. A study from the University of California, Los Angeles, published in the journal Clinical Cancer Research, found that pomegranate juice consumption significantly slowed the rise of PSA, prostate-specific antigen, a blood marker that rises as the prostate enlarges or becomes inflamed in men with prostate conditions. The doubling time of PSA, which physicians use to track prostate disease progression, increased from an average of 15 months to over 54 months in men who consumed pomegranate juice daily. That is a nearly 4-fold slowdown in the rate of prostate progression from a juice. The active compounds are punicalagins, which are converted by gut bacteria into urolithin A, a molecule that directly inhibits the inflammatory signaling pathways that drive prostate cell overgrowth. Urolithin A also triggers a cellular housekeeping process called mitophagy, the clearance of damaged mitochondria from prostate cells, which is important because dysfunctional mitochondria in prostate tissue generate the oxidative stress that perpetuates the inflammatory growth cycle. After 65, mitophagy efficiency declines significantly in prostate cells, meaning damaged cellular components accumulate rather than being cleared, and this accumulation directly contributes to the tissue changes associated with enlargement. George, 71, from Tucson, Arizona, had been experiencing nocturia, waking at night to urinate for 5 times per night for 2 years. His urologist had discussed medication options, but George wanted to exhaust dietary approaches first. We implemented a comprehensive protocol that included 4 ounces of pure pomegranate juice daily. Over 6 months, his nighttime wakings reduced to 1 to 2, and his follow-up PSA had remained stable rather than continuing its previous upward trend. His urologist noted the stabilization with genuine interest and documented the dietary changes in George's chart. Pair pomegranate with full-fat yogurt containing live cultures, as gut microbiome diversity determines how efficiently punicalagins are converted to the beneficial urolithin A, and probiotic-rich foods directly enhance that conversion pathway. Before we reveal the top 2 on today's list, and these carry the most extraordinary clinical evidence, I want to pause and ask something of you. If this information is filling a gap that your urologist or primary care physician has not addressed in the appointment room, please hit the like button right now and subscribe to this channel. Every week I bring you research like this, peer-reviewed and clinically grounded, and I want you to have access to it consistently. Subscribe right now and let's finish the list. Number 2, the nut I mentioned at the beginning, the one whose clinical trial from Vienna's Medical University genuinely surprised the urology community, and the one most men over 60 are not eating in anywhere near therapeutic quantities. Brazil nuts, just 2 per day. A study from the Medical University of Vienna found that selenium supplementation in men with benign prostatic hyperplasia produced a measurable reduction in prostate volume, actual gland size, measured by ultrasound, over a 12-month period, with the selenium group showing significantly improved urinary flow rates and symptom scores compared to placebo. Brazil nuts are the single most concentrated food source of selenium on Earth. A single Brazil nut contains between 68 and 91 micrograms of selenium, and the research-supported daily dose for prostate health is approximately 100 to 200 micrograms, meaning 2 Brazil nuts per day delivers the entire therapeutic Range without supplementation. Selenium works in the prostate through a family of proteins called selenoproteins, which function as the prostate gland's internal antioxidant defense system. Think of selenoproteins like security guards stationed inside prostate cells identifying and neutralizing oxidative threats before they can trigger the inflammatory growth signals that lead to enlargement. After 65, selenium status in men declines significantly due to reduced dietary intake and reduced absorption efficiency, and the prostate, which requires more selenium than almost any other gland in the body, is the first organ to feel that deficiency. The two-nut limit I mentioned earlier is not a suggestion, it is a clinical boundary. Selenium is one of the few nutrients where the therapeutic window is narrow. More than 4 Brazil nuts daily on a consistent basis can push selenium intake into toxicity territory, producing symptoms including hair loss, nail brittleness, and neurological effects. 2. Nuts, that is all. Store them in the refrigerator to prevent transidity of their high-fat content. Pair your 2 Brazil nuts with a vitamin E source such as a small piece of dark chocolate or a few almonds, as vitamin E and selenium function as a biochemical partnership selenoprotein activity, each enhancing the other's protective capacity. In the gland. And number 1, the nut with the most comprehensive and multifaceted evidence for prostate health of anything on today's list, the one that addresses hormonal balance, inflammation, circulation, and cellular repair simultaneously, and the one I would choose if I could only recommend a single food for prostate enlargement: peanuts. And specifically natural peanut butter, 2 ts daily. I know the reaction that produces. Peanuts are not glamorous, they are not exotic, they cost almost nothing, and the research behind them for prostate health is extraordinary. A study from Vanderbilt University's Vanderbilt Epidemiology Center analyzing dietary data from over 70,000 men across a 7-year follow-up found that men with the highest peanut and peanut butter consumption had a 21% lower risk of lethal prostate outcomes and significantly lower rates of symptomatic benign prostatic hyperplasia compared to men who rarely consume them. The mechanism is multifactorial and genuinely impressive. Peanuts are among the richest food sources of resveratrol, the compound famous from red wine research that activates longevity genes called sirtuins. In prostate tissue specifically, sirtuins suppress the NFFA-B inflammatory pathway. NFFA-B is essentially the master switch for cellular inflammation in the prostate, and when it is chronically activated, as it becomes in most men over 65, it drives the uncontrolled cell proliferation that produces enlargement. Resveratrol from peanuts directly down-regulates this switch. Peanuts also provide beta-sitosterol, a phytosterol that 2 separate European clinical trials found significantly improved urinary flow rate and reduced residual bladder volume, the amount of urine that remains in the bladder after voiding in men with enlarged prostates, and their arginine content supports nitric oxide production in the smooth muscles surrounding the urethra, relaxing urethral tension and improving the mechanics of urination independent of any effect on gland size itself. Arthur, 76, from Jacksonville, Florida, had been waking 3 times every night for 18 months and described his daytime urinary urgency as having taken over his social life. He had declined medication due to concerns about side effects and came to me specifically seeking a dietary protocol. We built his plan around natural peanut butter as a cornerstone, alongside several of the other dietary interventions on today's list. At 4 months, Arthur reported waking once or at most twice nightly. At 8 months, his urologist office called to say his follow-up ultrasound showed a modest but measurable reduction in prostate volume. Arthur's words when he called my office were simple. He said he had been to his grandson's birthday party and had not spent the entire afternoon mapping the bathrooms. 2 tsp of natural peanut butter daily. Ingredients should list only peanuts and salt, taken with breakfast. The fat in peanut butter significantly enhances the absorption of the fat-soluble resveratrol and beta-sitosterol compounds. Do not use commercial peanut butter containing hydrogenated oils, as these contain trans fats that directly promote the inflammation peanuts are otherwise reducing. For synergy, pair your peanut butter with sliced banana on whole grain toast, as bananas' potassium and fiber support the gut microbiome environment that optimizes the absorption of peanuts' anti-inflammatory compounds, and the whole grain provides additional beta-sitosterol. From the grain's bran layer, here is what I want to leave you with today. The prostate gland is not simply a passive organ that enlarges on a fixed biological schedule the moment you cross 60. It is a metabolically active, hormonally sensitive, nutritionally responsive tissue that is constantly being influenced by what you eat, how much you weigh, and what compounds are reaching it through your bloodstream. The nightly bathroom trips, the urgency, the weakened stream, these are not just inconveniences. They are the prostate communicating that something in its environment has gone wrong, and the research is increasingly clear that targeted nutritional intervention can begin correcting that environment meaningfully. 2 Brazil nuts, 2 teaspoons of peanut butter, 4 ounces of pomegranate juice, tomato sauce and olive oil, pumpkin seeds on your morning oatmeal. These are not dramatic lifestyle overhauls. They are the kind of small, consistent, evidence-backed choices that accumulate into measurable change. Change that can mean sleeping through the night, returning to social activities without anxiety, and reclaiming a quality of life that an enlarged prostate has been quietly stealing from you. You deserve that reclamation, and it is never too late to begin. Subscribe to this channel and ring the notification bell because next week I am covering the 5 beverages that urologists say directly reduce prostate inflammation faster than almost any dietary change, and combined with today's list, the protocol that emerges is genuinely powerful. And before you go, tell me in the comments which food on today's list are you adding to your routine this week? And have you noticed any dietary changes that have personally helped your urinary symptoms? I read every single reply. Take care of yourself and take care of that prostate. It responds to the right signals at any age.